In this video, I will acquaint you with 6 of the most common RGCC tests. Let's first begin with an introduction to RGCC International. RGCC stands for Research Genetic Cancer Center. This company was started in 2004 by Dr. Yannis Papasatorio, a medical oncologist researcher with his specialty in molecular oncology. From the start, RGCC International has been providing integrative medical providers with liquid biopsy testing for oncology and later included virology. In 2023, RGCC International was awarded a spot in the top 10 Swiss biotech company by Life Sciences Review. As a research and development company, RGCC not only provides testing but also develops novel therapeutic agents for personalized cancer and viral therapies. Chemosensitivity testing is a unique feature of RGCC testing that focuses on circulating tumor cells or CTCs and cancer stem cells or CSCs. The testing is able to detect tissue of origin. It also provides information on disease prognosis that includes resistance, recurrence, and metastatic risks. The chemosensitivity testing is performed in vitro by culture and sensitivity testing of the CTCs to show the drugs and natural substances with the highest therapeutic efficacy, thereby removing the guesswork for selecting the most effective cancer therapy agents. In addition to chemosensitivity testing, qPCR testing reveals the tumor-related gene expression profile that enables additional customization of therapies by enabling RGCC providers to include known therapeutic agents that block the metabolic pathways of the overexpressed cancer genes, thereby providing the highest level of integrative, personalized cancer therapies. The first test is Onco-D-clare. This is a cancer screening test for healthy individuals, those individuals that have never been diagnosed with cancer, but they have family history or they're vulnerable due to their work environment or their exposure to environmental toxins. This test can detect cancer before symptoms appear. It's a qRT-PCR test that measures gene expression of peripheral blood mononuclear cells, such as lymphocytes and monocytes. It is not a CTC detection test. It uses the molecular technique of qRT-PCR plus hierarchical and k-means algorithms with artificial neural networks. The accuracy is 93.34 plus or minus 2.88%. The true positive rate is 92.40 plus or minus 5.68%. The true negative rate is 94.78 plus or minus 6.78%. This is a whole blood sample. The approximate price is $870. The next test is OncoTrace. This is best used as a baseline test for all established cancer case and helps to determine where these cells are coming from. So it determines the tissue origin. This will determine whether it's a hematological or a non-hematological malignancy. It is used as a baseline test and can be used as a follow-up tool. It monitors the patient's pre- and post-treatment. For pre-treatment, there will be a certain circulating tumor cell number, and post-treatment, a few months later, it should show a decline in the circulating tumor cells, which would indicate there's less disease activity. There are biomarkers known as tumor stem cell markers that are detected that are associated with prognosis. c-Met is an example, which is a surface receptor on the surface of the circulating tumor cells that indicate if there's a high metastatic risk. Another biomarker, tumor stem cell marker, is the SOX2 that determines resistance to therapies and recurrence risk. This again is a whole blood sample, and approximate price is $870 US. The next test is Onco-Trail. This test is used when you know the primary origin of the tumor, and it specializes on specific cancer types such as breast, colon, GI, lung, melanoma, prostate, and sarcoma. There are additional biomarkers on the Oncotrace that's not featured in the Oncotrace. For example, for prostate cancer, besides the PSMA marker, they include the PSA marker as well. This is a whole blood sample, and the test costs $840 approximately. The next test is onconomics extracts. This test is a chemosensitivity testing for natural substances. There are 53 natural substances routinely tested, and you're allowed additional 5 agents to test with no additional cost. This test measures the anti-cancer effects by their signal transduction pathways, growth factor receptors, release of cytokines, and it is also determining the effectiveness against the hematological or non-hematological malignancies. It's a whole blood sample, and approximate cost is $1,700 US. The Onconomics Plus is a combination of the Onconomics and the Onconomics extracts. The Onconomics is chemosensitivity for drugs, while the Onconomics extracts is chemosensitivity to natural substances. The total substances tested in the Onconomics Plus is approximately 171 agents. The Onconomics Plus determines the most effective treatment options for cytotoxic drugs and natural substances. So this is the test to order for baseline purpose, as it provides the RGCC practitioner the comprehensive information needed to customize a therapy. It also includes resistance factors. That's resistance to treatment. The Onconomics Plus also provides the tumor-related gene profiles, and this helps in determining the additional customization for each case. It's a whole blood sample, and it is the most expensive test at $2,200. The Onconomics Extracts Plus is chemosensitivity for natural substances. It also includes the resistance factors that helps the provider determine how to overcome the treatment resistance of the circulating tumor cells, and also provides the tumor-related gene expression of the circulating tumor cells. It's a whole blood sample, and it costs approximately $1,900. For any questions that you may have, I will answer them weekly, so you can send it to askdrmiven@pm.me. We look forward to answering your questions next week, and it is a weekly video program. Thank you, and we'll see you next time.